added be fast. So you want to be fast, so the B is balance. So someone who's all of a sudden they're walking and they totally lose their balance. Not someone who has vertigo and has loss of balance all the time. This is someone who gets up out of the chair like this and they can't walk all of a sudden. They're like this. Something is happening in their head that you need to get help. E is eyes, vision cut. That's a good sign of a stroke. So if you're looking at this and you can't see one corner, that's usually a sign of a stroke. Good to know, right? All of a sudden you say, oh, there's something wrong with my eyes, maybe I should wait. No, you should get to the hospital and get checked for a stroke because we can help you if you get there quick enough.
Is it a blackness or is it a kind of a
It's a blackness, like if we get the video up, it'll show you a piece of the picture is missing.
Oh, okay.
And a good way to do it is if you're looking at me and I say to you, can you look at my finger over here? And you say, yes, I see it, it's right there. Can you touch it with your finger? Can you touch my finger? Okay, then I put my finger over here. Can you touch my finger over here? The person who has the vision cut on this side won't see my finger at all.
Oh, okay.
And I can go up and I can go down. They might see the one down here, but not up here.
Okay.
So that's really a great thing to identify. So that's the E. The face, have somebody smile. They'll have a droop.
Mm-hmm.
Okay? Now you don't have to have all of these things, just one to identify the signs of a stroke. So arms, keep your arms out. Can you keep your arms out? One will drift.
Yeah.
They'll keep drifting down.
Okay.
Okay? Speech, slurred speech, or the person can't say anything at all. You'll look at someone and say, hi, how you doing? And they'll go, nothing comes up. That's another sign of a stroke. This is a person who was fine, and all of a sudden they can't talk. It happens quickly. Your experience is like perfect. Your wife identified your symptoms, got you to the hospital. The biggest mistake people make is they wait too long. We have medication that can help people with strokes, but you have to get to the hospital quick enough. So it's 0 to 4.5 hours after the symptoms started. So if you find someone who's unresponsive and needs some help, call 911. Don't drive them there because you get there as quick as you can because everything is time sensitive. So when you get there, first place, I don't know if you were awake when you got there, but they ship you right to CAT scan, right?
Yeah.
And they look at your brain. And the reason they're looking at your brain is they want to make sure you're not bleeding in your brain. And if you're not bleeding in your brain, we can treat you with a medication called Alteplase or TPA. And what happens is the TPA, we give you the TPA, and it goes up to where your brain has a blockage, and it eats up the clot.
Wow.
And it's just like plumbing. So if it's clogged, all that blood can't get to your brain, and a piece of your brain is dying. It's also like having a heart attack, right? When you have a heart attack, the blood can't get to your heart, and you have chest pain, and part of your heart is dying. Well, with a stroke, part of your brain is dying. So it's really important because a lot of people say, oh, a stroke's not as important as a heart attack. Well, they're kind of the same. Once your heart's dying, and once your brain's dying, right? So you're in trouble. So it's good to get to hospital as quick as you can. One of the things we always ask people to remember is the last time they saw that person well. So say you're sitting in your chair and you're watching the game at 8 o'clock tonight. And your wife says, how you doing? You say, I'm fine. That's your last known well time. If she finds you at 9:30 unresponsive, that's when she found you.
Okay.
So we need to know when you were last known well, and that's how we figure out if you can have that medication or not.
Oh,
And the reason there's only 4.5 hours, that's FDA approved that it works. So the longer you wait, the worse your chances are of reversing everything. So the other thing they do is when you get to the hospital, they look at you, and if your stroke's bad, like you can't move one whole side, they call that your NIH stroke scale. And if it's over 6, we do a CTA. And a CTA, the first one was a CT, looked for the blood in the brain. The CTA looks for a clot. If we can see a clot, then we'll ship you into Boston or Leahy or somewhere that does intervention. They can actually go in and take the clot out. It is. So we'd give you the medication, the TPA, and the goal is for the TPA to eat up that clot and get rid of it. But if it doesn't eat it up and get rid of it fast enough, you're still not getting that blood to your brain. Your part of your brain's dying. So we need something to get it out. So they actually go in. It looks like a swirly little tool, and they can actually take it out.
Okay.
And then these people are fine. So we're seeing strokes. We've had a stroke at Beverly Hospital as young as 19. A lot in their 30s. Before, when you thought strokes, what do you think? 80, 90 years old, right? 70, 80, 90. Now they're big between 30 and 60. Huge.
Wow.
Why do you think they're much younger? Why we're seeing the
Well-
strokes? What do you think?
People are stressed a lot more.
Stressed?
Faster pace of living.
Diet.
Diet, our diet is terrible, right?
Big,
Overweight,
yeah.
but those are things we can control, we can help reduce,
Yes.
but some things you can't control. So it's one of the things they'll say hereditary. Did your mother have a stroke, your father have a stroke? Because your risk is a lot higher to have a stroke if they did. What's your cholesterol like? Is
Yeah.
your cholesterol, can you control it through diet? Or can't you control it through diet? Like, do they need to give you medication to bring that cholesterol down? Trying to
What
think.
about ongoing hypertension?
Hypertension, another big cause for a stroke. If your blood pressure is really, really high and the pressure in those vessels is high and you have high cholesterol, it breaks off a little piece and that's the clot
Okay.
that's traveling through, making that blockage.
Yeah.
So you have to be careful. So hypertension, we can control with your medication,
Mhm,
right?
Yes.
If they put you on a blood thinner, if you have atrial fibrillation, your heart quivers.
Yes.
Okay, so when your heart quivers, the blood sits in it for a little while. When the
Oh.
blood sits in it, it gets a little bit thick, right?
Yeah.
And then you do, and you pump your heart and throw some blood out, but it also throws a little clot out. And that clot can block your heart. That's why they put people on Coumadin.
Mhm.
So if you're on Coumadin, now say you're going in for a procedure, say you're going for a colonoscopy or an endoscopy, right? What do they have you do? Stop taking your aspirin, stop taking your Coumadin. Those people end up having strokes on us, so we have to be really careful with those patients too. Because you need the test done, right? But your risk of having a stroke is making your blood thick after it's been thin the whole time. So those are the kind of people, so if you're off your Coumadin and you get those symptoms, we need to get you right to the hospital so we can treat you.
Yeah.
Shame that everybody isn't in here hearing this.
I have these magnets, which I love. These are the Be Fast magnets. You should put one on your
I think
fridge.
I've
Oh,
seen this.
yeah.
Oh, this is so good.
The signs and symptoms of stroke.
Yeah.
I think it's great. I have one on my fridge. Some of my 11-year-old knows. My 30-year-old knows too. Would you like one? I'll leave one for you. I'll leave it up there. So you know that. So let me go through this real quick to make sure we're not missing anything. The signs and symptoms of stroke. Let's see. Taught you how to do that. Oh, what about a TIA? Do you know what a TIA is?
Mini stroke, little mini stroke.
Little mini strokes, and those are warnings that a big stroke's on its way usually.
Yeah.
So a lot of times, you guys were saying that transient global amnesia, that you're
Yeah.
forgetful. Sometimes you need to get to the hospital because it could be a TIA. And if it's a TIA, what we do is we work you up. We'll do the CAT scan to make sure there's no bleeding in your brain, and then we will change medications. Can you get in?
Not right this sec.
It's just not meant to be today.
It's just not,
Oh.
it's just giving us a hard time.
So one of the things that we can control, we talked about cholesterol. So I have my little cholesterol quiz that I love to give to people. I'll ask you some questions, they're true or false, and you tell me what you think. And then we'll go over the answers, okay? It says, high blood cholesterol is one of the risk factors for heart disease that you can do something about, true or false?
True.
It's kind of both, right? Cholesterol, because it's hereditary in your family. In your family, you're going to have high cholesterol, but we can give you medication. So it is true, we can control it. High blood cholesterol is one of the risk factors for heart disease that a person can do something about. High blood pressure, cigarette smoking, diabetes, overweight, and physical inactivity are others. Okay, so then we have, to lower your blood cholesterol level, you must stop eating meat altogether, true or false?
No.
False, right? False. Some red meats are high in saturated fats. You do not need to stop eating every single food. You need to cut back on some of the fats. So can you guys tell me what some of the fats are that you need to cut back on? Can you eat a lot of ice cream?
Oh.
Yeah, the ice cream's not really good for you. You want to lower your ice cream.
Oh.
And do you know how much the size of a piece of meat you should have? Like when you cut it,
Size of the palm of your hand.
palm of your hand. My husband likes his steak like that.
I gave up beef
Good for you.
decades ago.
Yeah, it's easy to do, it's hard in the beginning, but don't you think it's easier? Because I did the same thing.
It wasn't a hard for me at all.
Yeah, it was hard when everyone was having a steak for me, but now I'm used to, I love fish.
Yeah. fish is-
And it's
Yeah.
just getting used to changing your diet. Do you eat any beef, like hamburgers or anything like that, or are you all turkey burger? You do
Just turkey burgers
Turkey.
and, you know, I still have chicken and the other, the white meat. and
Yeah.
Some pork.
Yeah, see,
But-
that's good. Oh, you eat pork too, so that's good. Okay, so what should your blood cholesterol be? Do you guys know?
Under 200
Under two-
total.
Under 200. What about your LDL? That's your bad cholesterol.
It's under 30, I think it is.
Under 70.
70.
And especially, they tell people under 100 if you have no problems. You should be under 70 because you've had a stroke before. Your LDL is your bad cholesterol. Your HDL, I call it the happy cholesterol. You want that one higher. So those are good to have high. The LDL you want low. So it's below 70. So when they do your blood work, and you have to be fasting when they test it. Well, the doctor keeps an eye on it. I'm sure
Yeah.
they're watching you. To lower your blood cholesterol level, you should eat less saturated fat, total fat, and cholesterol to lose weight if you are overweight. Is that true or false? So to lower your blood cholesterol level, you should eat less saturated fat, total fat, and cholesterol, and lose weight if you're overweight. True or false?
I would agree with all that.
It's true. Saturated fats raise your blood cholesterol level more than anything in your diet. True or false? True. True.
Yeah.
Yep. So some of the saturated fats are butter, cheese, milk, fatty meats. And some of the good things that you can have is coconut oil, kernel oils. Do you change your oil? Do you use low saturated oils?
I don't.
I don't either.
Do a lot of oil at all.
You don't cook in
Likewise.
oil or anything?
Likewise.
No.
I don't
Yeah.
do
What about butter or margarine?
a little
I've
bit of
never
butter.
moved from butter.
They
It's
say
always-
butter is actually better for you than margarine.
Wow.
They say because margarine will melt at room temperature, so it's thick in your body. So
Yeah.
I learned that too. I didn't know
For
that.
example.
I always took margarine. I thought it was better for me, but it's actually not. All children need to have their blood cholesterol levels checked. True or false?
I would say because it could be hereditary and you want to know what it is.
Yeah.
Just,
It-
you need a baseline
A
at
bit,
least.
I agree with you, but the answer is false. They say high-risk families you should do it.
Oh,
So if your mom and dad has high cholesterol, then they should check the kids. Women don't need to worry about high cholesterol and heart disease. Ooh, that one's so false.
Mm,
We're at high risk.
absolutely.
Women are high risk, and your risk goes up at age 20. And after menopause, women's LDL, that's the bad one, tends to go up, and your heart disease increases for both men and women. But women are at higher risk because of the hormone changes.
Yeah.
Reading food labels can help you eat a healthy diet,
Healthier.
healthier. You read what you eat. Because I think it's confusing at the market, don't you? With all the different
Oh,
labels.
yes.
And everything is
And-
low fat, no fat, but you
Well,
really have,
and
Don't-
after learning that the whole campaign against fat was a scare tactic, or it was not really medically valid.
Mhm.
I mean, sugar is probably worse than fat is for you at this point.
well, when you look at all the things that have changed over the years, remember, no
Yeah.
tomatoes for a while, no coffee.
Yes.
Everything
Right.
changes. So it's kind of interesting. So here we have, these are our stroke, they're overreact magnets and magazines. What they do is tell you the signs and symptoms of stroke. And we'd rather you overreact than underreact and get to the hospital as quick as you can. At Beverly Hospital, there's the 10 signs of stroke in here too. There's another magnet maybe you guys can have. We see a lot of strokes and a lot of stroke mimics. So a stroke mimics is someone who comes in and they seem like they're having a stroke, but they don't. Something else is going on. We'd rather you come in and we figure that out. At least we have a baseline of what's going on. Like you had said, you had the confusion and the memory loss. Well, that's nice to know if she keeps going to the same facility, because we can all share records now. So if you go up to Holy Family Hospital, I can look at your records up
Right,
there.
right.
So if you're near Beverly and you come in, or near Leahy,
Yeah.
we share the system so we know a little bit more about you. And then we can look at her record and say, oh, this has happened before, you know, keep an eye on it. Hey, there's mine.
There, here we are.
Ooh.
We could,
That's cool.
that's,
Perfect.
so, but now, okay, that's good. Okay, so now, okay, I think, okay, so I believe we can get to the next slide.
You want me to just click it as I go through?
We can, I'm just trying to see if I can get it to actually,
Oh, so
and we went to the
fast.
next one.
Yep.
Hey,
Get away, Colleen.
So, so we just keep pressing the
I can
button?
do that.
I can do it.
No, I can do it. I won't be able to do that much now.
Stroke kills about 140,000 Americans each year. That's about 1 in every 20 that are deaths. But the worst part of stroke is the disability afterwards. It's not, people don't usually die from the strokes. They have to live with all the after effects. Like they can't move, they can't think, people are out of work, and it's frustrating, they can't go back, and they're slower reacting. A lot of people have trouble walking. And their family members have to take care of them. So say you didn't get all the movement back on one side, you might be in a wheelchair, right?
yeah.
You might not be able to go shopping or help your wife around the house or cut the lawn. You'd have to pay to have all that stuff done. So
Right.
those are things we're trying to fix. And I think we've made a big dent in stroke. When people came in before, you'd come in, would say, yep, you're having a stroke, and we'd admit you to the hospital and put you up on the floor, right? And we'd
Yeah,
give you
with no
maybe some
treatment.
aspirin. Now a stroke is like a heart attack. We announce it over the hospital. We say there's a stroke alert, a team comes running, and they're giving you medications, and things are done much quickly, because we're finding that we can make a real difference in people's lives. And we're seeing people before who wouldn't walk out of the hospital, who are walking out of the hospital and going back to work. So it's really nice.
Yeah.
Well, in my stroke support group, I have people that have had strokes, and their families come, and we sit and talk, and they say, you know, the doctor told me that I wouldn't be able to write and work and read anymore, and because of my vision. And everybody is so strong. If you tell these people in this group that they can't do it, they can do it. So the woman who was told she couldn't read and write anymore, she's written a book. She reads stories on TV.
Oh, this is,
Virginia McKinnon is her name.
she's the neuroscientist?
No, she's a stroke patient who was
Yeah,
told.
Yeah, there's, and I can't remember her name right at the moment, but there's a neuroscientist that had a massive stroke that it took her about 8 years to relearn everything.
Yep.
But she changed careers at that point, became an author, and started speaking. I mean, she did a wonderful TED Talk.
Mhm. This is what
she-
people need to hear.
The book that she wrote was Stroke of Insight.
Mhm.
Oh, very good.
Love it.
I think
And-
I've read the book, and I think I have it in a stroke support group. I'll have to go back and look.
It was
Martha.
very, I mean, even the short version of like 6-minute TED Talk is, I mean, because she goes through the whole experience
Mhm.
of being a neurologist or a neuroscientist, and you know, she's saying, well, isn't this interesting? I'm able to analyze what's going on while I'm having a stroke,
Mhm. I
And-
did read that.
Wow.
Yes.
and you know, and the different parts of the brain, the one hemisphere talking to the other,
Yep.
and one trying to assert dominance over the other, and it switching back and forth. And you know, she gets to the point of when she switches back to the creative side of the brain, and she, you know, experiences nirvana because the self-talk has been turned off.
Mhm.
The sense of identity
Mhm.
has just, you know, it's not there anymore.
It's so interesting. It's very, very interesting. I
It
always
was
learn
amazing.
something, like even talking to anybody, it's like you grab it and learn and bring it back. So the people in the group, I have a rower, a woman who was young, who was in her 30s, who had a stroke, and she was a professional rower, and she couldn't row anymore.
Oh.
And she couldn't move one side, and they told her she wouldn't be able to row anymore. She rows. She wrote a book about her stroke. She's another person who wrote a book about her stroke. The strongest people come there, and they give encouragement to everybody else. These young people come in, and they say, if she can do it, I can do it. And that's what people need to hear, because people, they can't tell you that things aren't going to come back, that your feeling's not going to come back. They always say 3 months, 6 months, and a year will look at you. And some of the people in the group, Virginia, who's 95 years old, is still changing, and she's still doing everything, and things still come back for her. And all she does is read, and all she does is write, because she wants her brain to continue to work, so they don't give up.
Yeah.
Would you like me to go on?
Oh, I was just gonna, let me just talk real quick. There are more women than men die from stroke, accounting for more than 67% of all stroke deaths. Stroke kills more than twice as many American women every year as breast cancer. Now, you wouldn't know that when you look at the commercials, right? Everything is breast
Yeah.
cancer, but stroke does. Up to 80% of strokes are preventable. That's big,
That's
that we can make a big change in your diet and all that kind of stuff. Should change that for me? It's a slow change.
Yeah. I'm still
Yeah,
trying
because
to
it's
get
thinking about the change.
to the,
That's okay.
I'm trying to get to the point where I really have a good understanding of why. Because I had a dissection of the carotid artery.
So dissection, it just means it tore.
Right, yeah.
So
but-
now the blood that wants to go to your brain can't anymore, and that's why.
And so, you know, I have never had any of the typical risk factors.
Did you have any, ever go to a chiropractor?
Oh, of course.
That's-
But
High risk.
it's, yes, but I'm not willing to damn them.
No, you don't have to damn them,
for-
but that is one of the questions they do
Yeah,
ask
and
you.
and they, of course, but everybody focused on that because, but I'm more likely it was the coughing that I was doing because I had a cold
You could have had a weakness in your vessel.
and that as well.
You could have done that too. But that's one of the questions they ask you.
Moving forward.
They'll say, have you seen a chiropractor? Because if you twist the wrong way or rip the wrong way, it can happen, a vessel can go. And some people, right after they go to the chiropractor, they
And
have that.
was
Coughing, you
over-
could,
over a
hereditary,
week.
you could have had a weakness there and
Yeah.
it just burst. So that blood that's supposed to stay in that vessel, that's going to your brain and feeding your brain, can't go there anymore. It's going somewhere else. The road turned this way. And you're really lucky. That's why you were transferred to Boston, not because of a clot. You were transferred because you had a bleed, and they had to control the bleed. So when your vessel opens and it
Well-
rips like that,
Got it.
And they said
I
that
got the
there
next
was
one.
there was a substantial blockage from plaque.
Yeah.
But where that came from, I'm not sure.
so now you're very interesting to me because you've had a dissection. So did it rip and break and you had bleeding?
But
Because they
I
wouldn't have
don't-
given you GPA for that.
I don't know that it was bleeding there because they said that there was a blockage of the artery.
So what could have happened is your
Right.
vessel could have, see your vessel's like that?
Yeah.
It could have went like this. So the blood's not going out into your body, so there's not bleeding, but it's blocked, so the blood can't go to your brain.
So, yeah.
So your
And-
vessel
and
looks
it-
like that.
And it did throw a clot.
Yep.
Uh-huh.
So that's what could have happened to you. It's hard because I don't have your case in front of me.
Yeah.
Like if your vessels are like this, right? Your blood's going through and say it rips, but the skin goes this way. Now the blood can't, there's a blockage. Someone put something in the road and now you can't get by. And the skin can open by itself. Medication can open it. There could have been a block there. So you're really lucky. You did
And-
really well.
And now, there's no evidence of anything.
Oh, that's beautiful. That's good. You're like the miracle man.
Yeah.
I like it. So the major impact of stroke is not death, it's disability, and that's what we just talked about. The weakness, the vision loss, the speech problems, and the memory problems. Disability can leave people unable to work, or everyday life things like putting on your clothes, cooking, feeding yourself. Those are the things we called all our stroke patients in 30 days, and we asked them, what are you able to do now? Like, has everything come back? Do you need help cooking? Do you need help writing your checkbook? Because that's disability. You can't do the stuff you used to do before. So what is a stroke? The injury or death of brain tissue, and we've kind of already talked about this. So there's two kinds. It can be from a blockage or a rupture. Oh, I think the next one's going to show it.
Okay.
So the ischemic stroke, if they're talking about you've had an ischemic stroke, there's something blocking the vessel, so the blood can't get to the brain. Most of the strokes are ischemic strokes. Those are the ones we treat with the TPA, with that medication. We want to open up that blockage. Much easier when you can see the picture, huh? All right.
Sorry.
No, that's okay.
It's a
It's just, it is helpful, then
Yeah,
better than
You
me
finally
saying.
got it going.
And the
Between
hemorrhagic
this-
is when it bursts.
Ah,
So
okay.
now your vessel broke, but instead of the blood going to your brain like it should go, so all this blood is trapped on the space outside. So your tissue isn't getting the blood. It's building up in your head, and you have a skull around it, so there's nowhere for the blood to go, so it
And
pushes
the
against the brain and
pressure.
kills the tissue. So we have to stop that bleeding. So time is brain. The brain ages 3.6 years each hour without treatment. So that's why we say we got to treat you as quick as we can. So for every 30 minutes delay in acute reperfusion leads to 10% relative reduction in likelihood of a good outcome. So the longer you wait, the worse the outcome is. So be stroke smart, understand the 3 R's. Reduce your risk, which we talked about, lowering your cholesterol, changing your diet, your weight control, controlling your blood pressure. Recognize stroke symptoms, that's the be fast. And it's not only for you, it could be for anyone, somebody here who's having stroke symptoms. And respond by calling 911. So we talked about the be fast, the balance, the eyes, the face, the arms, the speech, and the time. And if you click through, it's going to go through them one at a time. So that's the balance. A great test if someone's sitting there just like I did with you. I put your finger, can you touch my finger? Somebody who's off balance, put your finger up for me. I'd be going like this. They can't put their nose to your finger. They're way off. So that's how you test balance. Eyes, there's your vision cut.
Okay.
That's what I'm talking about.
Thank you.
That's the normal picture, and there's your vision cut.
Wow.
And it could be just one corner.
Yep.
So that's when you need to get checked quickly. Face, that facial droop. Just have someone smile and you can see it. There's one thing that can fool you is Bell's palsy. A lot of people have Bell's palsy and it's the same thing. But just go to the hospital, we'll tell you if you have Bell's palsy or if it's a stroke. Arms up, one's gonna go down. You can't keep it up. Remember, only one of these things, and that's where you treat for stroke. You don't have to have them all. Speech. Have them say a sentence, clear articulation, or is, if you can talk and say what I say, I'll say, can you say Boston, Massachusetts? And they'll say Boston, Massachusetts. Or can you say the sky is blue? And they'll say the sky is, blah, 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 blah. They can't say it. That's abnormal. Or they can't talk at all. So time is brain, call 911.
Yeah. I got really tired of those every day. It
Right.
was the same thing.
The same questions we keep
Yeah.
doing over and over
The same,
again.
the same, like phrase, and
We should
I-
tell
I
them,
never had
hey,
a
no more of
problem.
that. No, but we do it. And I'm sure when you went to Boston, there's the residents too. So the residents usually come in before the doctors.
I would give all of the residents a lesson every day when they came through. If you want to complete your medical training correctly, check yourself in here for a week. Because the hospital experience is so dissociating and disorienting.
Yes.
It is the most horrible place to try to get better.
It's true.
It would
It's true.
really cause some confusion.
It's
for
true.
And-
If you go into the ICU, which I'm sure you were in, like a critical
I
care
was
unit,
initially, right.
so you don't know what it's daytime or nighttime, right? Because we leave
Right.
all the lights on. There's beeps every 2 seconds. Not only yours, you hear other people's beeps, right? You try to fall asleep. What do? We wake you up. Yeah. In the morning, we take your blood. We tell you when to eat. You can order your food, but it's when we bring you your food, when to get out of bed, when to we talk about this all the time. We try to make it quieter for patients, try to help patients relax, but it's tough. It is, it's a tough place, especially in the ICU, when I say, check his blood pressure every 15 minutes, so you're trying to sleep and someone's taking your blood pressure every 15 minutes.
Oh,
So other symptoms of a stroke, severe headache. People say, I have the worst headache of my life, and they say, they've had migraines before, but this is terrible. I can't move my head. That's a sign of a head bleed. So if you have the worst headache ever, you need to get to the hospital, have a head CT to make sure you're not bleeding in your brain. That's really important. Confusion and memory loss, or trouble understanding, or dizziness or trouble walking. If that's unusual for you, you need to get checked. Some people go to the doctor will pop you into the emergency room, have an ambulance bring you to the emergency room, but you just wasted an hour. And remember, that clock is ticking. You only have 4.5 hours to give you that medication.
Difference.
So that's really important. So TIAs are little mini strokes. They're the symptoms of same as a stroke, but they go away within 24 hours. They're warning signs of a stroke could be coming. And it's good because when you get to the hospital, a neurologist is usually consulted and they'll give you medications. They'll either put you on aspirin or Plavix or a blood thinner. And then trying to figure out why you've had the TIA. They'll probably check your cholesterol. And if your cholesterol is high, they put you on a statin.
Mhm.
So the big thing is don't delay, be fast. So sometimes people think nothing can be done, the symptoms will go away, but the longer you wait, we can't treat you. A lot of people are afraid to take the ambulance, and I agree, the ambulance is ridiculous in price, it's crazy. But we gotta get you to the hospital fast, and they call us in. They'll say, okay, we have a potential stroke coming in, and you'll say, so what does that do? Well, we put out a BEPA system, and the BEPA system tells the CT people, well, you're gonna go for that head scan, clear the table, I have a stroke coming in, their number one priority. So they are waiting for that patient to come in. We also beat the lab and we say, you're gonna have labs coming, and my stroke patient is super stat. We put stickers on them, I need those labs back as fast as I can. The neurologist is paged. So everybody has the heads up that you're coming in. Even if you get there and they say they're not a stroke, everybody is already ahead of time, they're working. So it's really important that you have the ambulance bring you in. If you come in through triage, you drove your little car and you come in, there's a nurse out there who takes your blood pressure, there's a registration person, and they say, go take a seat, right?
Please.
And how long do you wait before
Yeah.
someone figures out you've had a stroke? At our hospital, we've changed that. If you come in with any of those BFAST signs, the nurse right away calls a stroke alert, and you're brought right to the back. It's kind of like having a heart attack, and we work you up just like you came in through an ambulance. Because we did notice that. We noticed a big difference. People would come in and they'd sit there and say, how are we helping them? Two different levels of care. Now the levels of care are the same, and we're trying to, give everyone the treatment they need. It's kind of interesting.
And the other piece that I worry about is in case something were to occur while people were driving in the car.
Oh,
your spouse
definitely.
drives, says, I don't want an ambulance, just drive me to the hospital. What happens if something occurs while you're during that drive?
Right.
I say,
It's
You
so
don't wanna
true.
put
I
them
was
in that
thinking
position.
someone would bring you and drive you, but a lot of people do drive themselves and they end up crashing, and then we have a trauma and a stroke.
Or if your spouse, your partner drives you and something occurs while, the partner's driving and
Can't do
the
anything.
patient, they're, talk about trauma then too.
Distraction.
Yeah.
Well, I mean, the partner is then in the position of having to pull over and call 911 and get help, and we've
Yeah.
lost more time.
Yeah, it's so
Yeah,
true.
I just don't want to put people in that position. All right, here we go.
And I
One more slide.
We made it through, we did it.
Got it.
Together we have done it. Do you guys have any questions for me?
Well, I actually have, I'm wondering, because one of the things which I have been experiencing since this started is that my sense of taste
Oh,
is completely fluid. I mean, everything
people say
tastes
that.
bad.
Mhm.
Everything, I mean, what somebody
Have you
said-
asked your neurologist?
I did, and nobody has said anything really at
If you
all.
give me your email, I can send you a pamphlet, because it does say where the taste is affected, and we'll look where your stroke is. Where you had, which part of your
Okay.
brain, and see if that's affected there.
That would be very interesting.
So I'll send you that, because I don't have that pamphlet there, but it's great. And then the other thing is, Dr. Kelleher is the chief of neurology at my hospital. I'll ask him, can you taste, and I'll email you the answer.
That's great,
Okay.
thank you for doing
All right?
Yeah.
I can't promise you answers, but I know that piece, thanks, with the pictures tells you exactly what's affected and where. And it'd be great, like, if you know where your stroke is, like, when you look at a picture of your CT, do you know exactly where it is?
It was, I don't at this moment. And all I've been told, and I have also found that things that you are told in the hospital have a probability that maybe there's a kernel of truth in them, but that you really need to follow up and ask multiple times to really find out what the real situation is, because you don't always hear
I tell people
exactly
to
what.
get their records, ask for their records so
Yeah.
you can read them. And then the other thing is have access to the patient portal. You can go in any way you've been treated. So like if you come to Beverly, they give you a password and you can see all your records, all your blood work, everything. So if you can read, go in there and read it. Like if you could get one, you went to Boston, right?
It's Boston Medical.
So you go to BMC and you can go in, ask for access. They'll tell you exactly.
Somewhere in this area.
But you'll be able to look at the picture and you'll
Yeah,
be able to see
that
it.
would be
It's that.
useful.
So I'll send you that,
Okay.
okay?
That's fabulous,
Ah.
thank you.
Yeah, it'll be neat. I'd love to know the answer too. And so I'll email Dr. Kelleher too. And I'll try to Google it a little.
Thank you.
Yo, you're welcome. Do you guys have any more questions for me?
Just, general sensitivity over my body in various spots at this point is, changes every day. Side of my nose or my forehead or, my arms. I'd be real, like nerve sensitive and then gone.
Yeah. And what medications you want? We could do this off the side too, but
Aspirin.
just baby aspirin.
They put me on
A statin?
a statin.
I wonder if it could be a side effect from the statin.
Well, the first statin was massive side effects. I mean, I thought I was getting a cold before I got out of the
Mhm.
hospital, and it was a side effect of the statin.
Yeah.
And I got off of that one. I'm on lovastatin at this point, a lower dose. And, but I'm wondering if the taste is
It
because
could
of
be.
the statin.
It could be, and then the other thing, because there's a lot of them, there's different statins, and there's a new one that's out too. I'll have to email you that one. It's supposed to not have as many of the side effects too.
So I got off the first one as quickly as I could because it was just destroying me
So before you were in the statin, did you have the problems with your taste?
with,
The taste and not being
no,
able to?
no. Because it started while I was in the hospital and has continued since.
Oh, so you had it before they started you on the statin, maybe?
No, because what is it that they inject? That's a blood thinner.
Oh, yeah, that's so you don't get a clot when you're in the hospital, the heparin or the
The
Lovenox.
heparin, I think it was, yeah.
Yeah.
But they put me on the statin while I was in the hospital.
Mhm. I'm just gonna get a pen, I'm gonna write it down, because it's Abrastatin, right? What the drug?
Charlie, did you get this last slide with her contact information? No. Then I could go get a pen. Yeah.
Repeated.
Do you want to just repeat your contact information?
It's Eileen Constantino, stroke manager, Beverly and Addison Gilbert Hospital,
Look at me.
Oh,
978-922-3000, extension 2235. And you're welcome to call me if you have questions or concerns.
okay. I'll go get a pen before they get out of this.
I have a question.
Sure.
How do you tell the difference between
Why did I just go on?
loss of memory, or old age, or dementia, or a stroke?
A stroke, you'll see it on a head CT.
So
So
then if you're just sitting at home,
you always come in. When in doubt, come into the hospital, we'll figure it out. When in doubt, we'll figure it out. That, because we don't know. Dementia is long. Like if you're confused every single day for a long period of time and you're being treated for that, that's different. But someone who, like you're talking to me, you're fine, and all of a sudden she's in a class in here and she's doing yoga, and she can't move her right side, or all of a sudden she doesn't know where she is. There's something wrong. We need to find out. It could be a stroke, it could be something else, but there's something wrong, we need to find out what it is. Those are the people you don't want to wait. Or if you get up out of your chair and you're dizzy, and you're not just a little bit dizzy, you're like, oh my God, this whole room's spinning. Let's figure out what it is. And something's going on. I mean, you could have the flu, you could have a virus, you could have vertigo, but we need to figure out what it is, because if it is a stroke, then we need to treat it. We always say over triage, overdo it, and then we'll go backwards. So it might not be a big bad stroke, but let's find out what it is. We treat everything like it's a big bad stroke, so it's good to do.
What a change in treatment.
Oh,
And when it happens.
amazing.
It is.
Yeah, how things have changed. I just want to write down your medication, because I want to look it up after.
And I don't remember what I was initially put on was like
Daperstat, you said, right? I say it wrong, but I know what it is.
okay.
I got it.
And one of the side effects is it mimics a cold.
Mm-hmm.
And it was just way, I mean, it was like I was on like 80 milligrams, and it was just blasting me
So
out of the water.
your cholesterol must have been high, because that's the highest dose.
But I have not had, I mean, over years of testing, my triglycerides were a little bit off, but that's come in line
Mhm.
over the last 2-3 years. And my total, well under 200.
Mhm. I wrote it in my
Oh,
phone,
you-
thank
oh,
you.
okay.
But thank you.
Chris, do you need me to
Yeah,
write- wanna write?
I'll definitely write that down.
Do you want, what can I write for you? Are you?
Just the contact information.
Oh, no, just turn it all off.
Oh, I can tell you.
Okay.
I know that.
She probably knows it by heart.
Here, let me write it for you.
Okay.
Oh, and in
That's
fact,
even
Chris,
easier.
I think we have it back here.
Ah.
I could,
You can take that.
I was just gonna say, do you want me to make you a photocopy?
I think I have extra ones over there, you can have it.
Martha, would you like a copy?
Oh, yeah.
We've got
Let's see.
most of that. I mean, you've actually cleared up
Oh, there
quite
are
a few
copies here.
questions
Yeah, I'm gonna
about
keep a copy too.
what I went through, why, you know,
Excellent, really
why
wonderful.
why I went to
Charles, would you
Boston
like one too?
after things seemed to have already been taken care of.
Yeah, do you need the pen too, or anything?
Uh,
I'll give you back the
uh,
pen.
And
Is your
they-
video done? Can you make me look thinner?
It's on the engineer now.
Huh? I need to get a little bit thinner. Someone told me to stand sideways.
I do love it. Would that work for all of us? That would be nice too.